a senior program manager with TASC Center for Health and Justice. A lot of you guys are probably familiar with TASC. So I am working on a project funded by DHS Super, setting up deflection programs, pre-risk diversion deflection programs all over the state of Illinois. The hope is to cover all 102 counties. So with that, when I started these programs, I found out a really cool thing called ROSCs. I had no clue what I was doing or what those were at first. In the first couple of meetings I was in with ROSC people, they were like, you guys are doing the exact same thing we're doing, which we do similar work. So that's what this is about, is kind of finding out the difference between ROSCs and deflection, how they're similar and different, so that you guys can hopefully, when we do come up in your area, you guys are aware of that and you guys know the difference between the two. Jeff, I think it's all you. You can introduce yourself.
Hello? Hi, no, you up. Hi, my name is Jeff McFadden. I'm the System of Care Coordinator for Bridgeway's West Central Illinois ROSC. I cover 6 counties about 2 hours southwest of here. Galesburg, Illinois, and the counties that surround it. Recovery-oriented system of care. This is straight from a one sheet, okay? It's basically anything and everything that's going to help promote multiple pathways to recovery and help people on their journey of recovery. We take value in people's lived experience, and something I've learned more recently is also listening to people who are living in the experience. But yeah, we're proud to be one of, the graphic was up earlier, 43 ROSCs that cover 57 counties and 102 counties. This, if you're not familiar, this is the layout as far as ROSC goes in the region. Region 1 is Cook County, Region 2 is the suburbs in northern Illinois, Region 3 is the light blue, Region 4 is the purple, and then Region 5 is down south. And what's awesome about this is I tend to know someone who are affiliated with the ROSC in different areas. I've received calls from people who are in St. Clair County, people who are in Franklin County, and I can easily kind of mentally access the information and set them up with the ROSC coordinator or the RCO or the anything recovery related in that region or area. And here you go. And this is just a little bit of some of the stuff we've done. We had a ROSC dinner and awards night on March 2nd. We honored people and gave them a little award and fed them and all sorts of good stuff for their help in ROSC, in matters in helping get people to detox, to treatment, help in any and every way. It's a very fun, successful event. Our peer recovery support flyer and whatnot, and this is cool. We were able to get our second free Narcan test strip and Plan B vending machine in Knox County, which is Galesburg, Illinois. She was with the Housing Authority for quite some time, and it was her idea, and we have been able to distribute a lot of Narcan and test strips and Plan B, and that's awesome. That's really awesome. I think to date we've distributed in the past 9 months about 1,700 doses of Narcan.
So how many of you have heard of the word deflection before? And you know what it is? Okay, that's good. So deflection, diversion, there are a lot of similarities between these two, but there is a lot of also differences. So I just want to go over clarifying the differences between those two first. So deflection, you're going to be centered more in the community. And that's where we want it. It's where the people are that are in recovery. That's where we want to keep them because that's the best place for them. Diversion is centered in the justice system, and that's not always the best place for everybody. With deflection, we're moving people away from the criminal justice system before they've even entered it. So getting to them early on and preventing them from going into it even in the first place. And then with deflection, there's also hopefully not going to be that official arrest record, that you're not going to have those charges present, which as many of you know, can hinder a lot of stuff, hinder getting into housing, employment, food, any of those resources. Deflection is more about engagement. So we're trying to get people engaged, and we're trying to engage them into services, get them engaged in the community. With diversion, it's more about that compliance. You've got that probation officer, case manager saying you've got to comply with all these rules, you break them, you're going back into jail, whatever it might be. And then deflection, it's also more behavioral health guided. So we're working with more of those treatment providers saying, hey, what do you guys think is best for this client? What's gonna be, what do they need? Not the probation parole officer, hey, what do you guys think they need? And what is your perspective? So it's more of that behavioral health guided. Deflection goes by a lot of different terms that you can see up here, and all of these just fall under that umbrella term of deflection. Gerald's Sauk Valley Voices of Recovery, that is actually a deflection program. Safe Passage, that's a type of deflection program as well, as you guys probably have heard already. Whatever you end up calling it, it doesn't matter. What it boils down to is it's a third option for police and first responders to take. So a lot of times when they're on scene, they go to a call, there's no arrest to be made, but they can see that someone's struggling with either substance use, mental illness, maybe being unhoused, and they know they're gonna come back there the next couple times. So over the next couple weeks, they're gonna probably be back there. So instead of the officers just walking away and saying like, or just giving them a card of, hey, call Bridgeway, they can make a referral to a staff called a deflection specialist. And that deflection specialist then goes out, contacts that person, and helps get them connected to services. So easiest way to explain it, we're not waiting for any of these to happen. We're trying to react early and trying to actually be preventative. It's just an early upstream prevention pathway. So for your visual learners, this is the sequential intercept map of the justice system. Sorry, Jeff, I've worked with Jeff enough, but this is our first time presenting. How many of you in this room know Jeff personally or know him somewhat? Okay, so you all know what my struggle is up here trying to stay straight.
I'm being perfectly pleasant and straightforward.
I made it this far, it's pretty surprising. So this is the justice system, and this is where deflection lies. So just in the community before they enter the justice system, where police and first responders are going to be. And by offering community-based services, housing, peer support, treatment, whatever it might be, by doing that here while people are in the community, we're going to keep them out of the justice system, we're going to keep them in the community, and we're going to also give officers another step to take, another tool in their tool belt. So these that just popped up here, this is all diversion. And we've been doing diversion for like 60 years now, and we've learned a lot of different lessons from diversion. Luckily, they got to be the guinea pig, they figured out what was good, what helped, what wasn't. So providing that well-rounded care, getting them into treatment, housing, food, whatever it might be, any of that, instead of just focusing on just like a clean UA, by offering all of that, that helps reduce recidivism and help get them stabilized and become productive members of society. So we took all that lessons that they learned, we just simply moved it upstream earlier. Why not get to people earlier and offer them services earlier? Why do we have to wait? So again, deflection is prevention. So right now in the US, the average time frame, if somebody comes in contact with a first responder, and is like, hey, I want to go into services, the average wait time right now is about 6 weeks, give or take some. So that's a big gap, and a lot can happen during that 6 weeks. So what we're trying to do with deflection is we're trying to close this gap. And I know Gerald and his team at Sauk Valley Voices of Recovery, they do a wonderful job of this, of trying to close this gap by offering different services, getting connected with them, and engaging with these people as well. We know we're not going to be able to close the gap immediately. It's not like, well, some of you might actually be out at 2 a.m. in the morning. Some of you guys are awesome rock stars, I've been learning, that go out at 2 a.m. But a lot of times treatment providers aren't out at 2 a.m. on a Saturday morning. But we're trying to close this as much as possible. So with this warm handoff, what we need 3 things for deflection. First of all, we have 1/10 is on our first responders. Because our first responders tend to come in contact with people who need help earlier, before they go to treatment and before they go seek help. We want to leverage those contacts, and that's where we're really trying to work with them. is because they come in early, they get in contact with them early, leveraging those contacts. That helps us as treatment providers get to them quicker. But we also need the interventions from the service providers, right? We need you as service providers out here. Because without any interventions, no matter what, law enforcement, if they can make all the referrals they want, but if we don't have those interventions, nothing's gonna change. And then one third thing we need is relentless engagement. And I know Gerald's staff does a lot of this, and does a great job of this, of going out, relentlessly engaging people. Never giving up on somebody. Even when they tell you, F you, I don't want to talk to you, please stop calling me. Because maybe tomorrow, they're really in need of something, and they could really use that help. So, Jeff, I'm gonna give you off to why you do deflection.
Oh, sure, no, perfect. This is one of my favorite slides because it features, 6 of my 19 mug shots. Okay, now, God bless Koren, because she chose some of the most uninteresting ones possible. I mean, yeah, you didn't put the smiling one in, you didn't do the one where I'd been awake for a week and all, but you chose these. But the point is, I was involved in the criminal justice system so much. Very, very minor offenses, everything that she described, how deflection is preventative, everything that you're not waiting for a crisis, an overdose, an event, an arrest, to get the person help. So when she says, why do deflection? Well, this is why. So people don't end up like that, continuously going in and out of jail. I mean, I've done probably 2 years in the Knox County Jail. The very badge that I now have, that I go into the jail, that very jail that I've done all my time, I now go in there as a counselor to do peer recovery support groups, okay? We do so much with ROSC and so much with everything. Think about it, how many Jeffs do you know? How many Brysons do you know? How many Shelleys? How many Leannes? How many Kellys? How many of those people do you know? If we can stop it before this, fortunately for me, as a matter of fact, just 1 week ago, I got my felonies expunged and sealed. That just happened within the past week, and I'm extremely fortunate for that. But it doesn't have to be that way. We don't have to wait for those events, those things to happen. Fortunately, we even have here, my nephew. We did a viewing of the movie Generation Found, which shows the recovery high schools in the United States. My nephew with Oxford House in the purple, Bryson McFadden, in this he has a year in recovery. Now he has over 2 years, he has approximately 825 days, and he's employed as an outreach worker for Oxford House. Amen. And he's been to prison. He has just as many, am I right, Bryce? You have just as many, probably, just obviously not as good looking. Probably more. But he has that. A lot of us in this room have these. Okay, if you're interested in the other 12, I have them in my car. We can get to them later. But this is why I'm passionate about it. This is why when I got the pleasure and privilege to meet Koren in the deflection initiatives 18 months ago, yeah, just shy of 2 years ago, I was like, Leanne and I was sitting there, and just like she said, wait, this is ROSC, kind of. Very similar. Their mission, goals, and values are very same. So we even said, hey, this is very similar. And what I explain to people is, a lot of people in the differences, I say, we work side by side. The continuum of care, it can encompass everything. It should encompass everything. It's about saving lives, improving the quality of life, promoting multiple pathways to recovery. If they're not ready for inpatient, outpatient, that's okay. But you need resources for a food bank. What would ease you? Getting an ID? You don't know how to get an ID? Oh, you need help getting your social security card? The food bank, resources, this, that, and the other. It all promotes recovery, promotes better quality of life, safer communities. TASC, Treatment Alternatives for Safer Communities, TASC.
For me, why I wanted to go into deflection, I'm a former police officer, and I remember responding to calls like I explained, where you're going on scene and you're like, yep, I know I'm going to be back in a week. And just knowing there's got to be something else we can do. There's got to be something else other than coming back every time until we wait for an arrest, and then watch them get kicked out of jail 2 days later and coming back again.
And incidentally, I now am employed through Bridgeway, the very outpatient that I graduated from. But you know how many times I would even kind of complain, sort of, to my arresting officer and say, man, I just don't know what to do, you know? And they would just, through no fault of their own, there wasn't that much available at the time, but DeKalb Bridgeway, the company I now work for. But you know, how easy, I'm worried about how I'm gonna get out of jail, if I'm gonna get out, what my spouse is going to be doing while I'm in jail, are my dogs gonna be okay, where's my phone? You know, all this other stuff. Call Bridgeway, I don't even have a phone. I have like a broken phone that has a text now number that you can only text, you can't make calls. Call Bridgeway, what are they gonna do? You know, and it's just a cop who, you know, I went to high school. Well, just call Bridgeway, Jeff. Well, no, that'll be in a couple months because I have some high warrants. This was back when there was bail. You know, like, I'll be sitting for a while. You know, and I'm not gonna, that's not on the forefront of my mind. It's survival in the jail system, and worry, despair, guilt, shame, keep going, everything.
So yes, with deflection, you're gonna have that engagement specialist that's gonna help you get that phone. That's gonna come and visit you and say, hey, what can I do to help you? Okay, you need a phone, let's go get you one. You need an ID, okay, let's get you one. And then say, okay, when are you ready? You're not ready for treatment? Okay, that's fine. What else can we do? And how else can we help you? And when you are ready, come see me and I'll make sure you can get into treatment early. So this is some of the deflection sites that we have up and going already. So if you guys notice, actually the area that we're in right now is up there in orange. We're gonna be starting working and enhancing Sauk Valley Voices of Recovery. So we're gonna be coming in and working right alongside them and enhancing the program that's already in place, because Gerald has done really great work in this community, has already made a lot of great so as you can see, we have them all over the state. The goal is all 102 counties. I think we're at 46 right now. So that's the whole goal in the future. So differences. So Jeff, what do you see as the biggest difference between deflection and ROSCs?
Well, I think with ROSC, we take, a deflection is more before there's criminal justice involvement. Am I right?
Yes.
It's before there's criminal justice involvement. Now, we've had many discussions where, are you still going to help the person even if there is criminal justice involvement? You bet. You know, but ROSC, for me, ROSC is anything and everything. Multiple pathways to recovery, improving quality of life, regardless. What's your recovery path? Good deal. Let's keep it going. You know, because what we found, you know, there's many paths to recovery, and many work. Some work better for some, other works better for others, and other works better for others. But it's basically all about being a good human being. So if you go, don't go back, but like, you know, those mug shots, yeah, keep those. You know, I want to prevent that. You know, I want to help prevent, you know, think in those counties where there's deflection and where there's ROSC, where there's RCOs. You know, think how many uninformed, scared, shy, nervous, ashamed Jeffs there are. How many Brysons there are. You know, how many people need this, need that. You know, the relentless engagement. To have someone, how cool would that have been for me? You know, whether I would have been receptive or not, that's not the point, but would it have made a difference if someone would have kept checking on me oh, his phone doesn't work, or the text now subscriber you have called, is, they show up at my house. Would it have worked? I mean, I'm extremely grateful and happy where I'm at today in my recovery journey. I live a fantasy today, it's unbelievable. But I think of what if, for others. Like, how cool is that? And that's precisely what deflection does, or has the ability to do.
So yes, there are a few differences with deflection and ROSCs. One is the stage of intervention, as Jeff said.
Jack is the name of her boss.
I present with Jack a little too much, so Jeff. As Jeff said, deflection happens early in the justice system. And then recovery-oriented services of care can come into a different ongoing recovery process, different parts of the recovery process. It might be diversion, might be even if someone who hasn't even come in contact with law enforcement. I've heard some of you here today that are in recovery, you're like, I never even came in contact with law enforcement. I don't even have a history. So that's where the ROSCs come into play. Deflection's primary focus is preventing justice system involvement, so that's the real primary focus with deflection. So we are working with those first responders, that law enforcement, that's the key to it. With ROSCs, it's focusing on long-term health and wellness, regardless of if they have that justice system involvement or not. And participants for deflection, law enforcement and first responders are the ones who lead that deflection. So they're the ones who come in contact with it and are making the referrals and are giving us those people's information. They're the leaders of it. And then both our healthcare providers, treatment professionals, recovery communities lead recovery-oriented services of care. And then we also have persons of lived experience that we want in both of those. So with our deflection programs, when we set them up, we always want to have people with lived experience. If we're making a program for you, who said it? With us, not without us. Like, if you're going to build a program for us, you better have us at that table. So that's something I always encourage my teams, whether it's here in Illinois or anywhere else in the U.S. So, as you heard good Lord, Jeff. I'm just going to walk away at this point, Jeff. As you heard Jeff say, a lot of times the same people are at the table for ROSCs as they are for deflection, because ROSCs and deflection all have the same thing. We're running to help people in recovery. So we want all those treatment providers, we want all of the other service providers, whether it be food, housing, the spiritual leaders of the community. We a lot of times have big pastors from the communities at our tables as well. We have chiefs of police, some Chief Yates with Quincy, Illinois, huge advocate for deflection as well. So there are a lot of similarities, but there are some differences, and we work right alongside with each other. We try to promote each other's work as well, and make sure that we're advocating for each other. Okay, Jeff, do you want to do anything? Do you want to say anything else? I think those were the similarities. I kind of went off mine. Yes.
Joanna has a question.
No, actually, I just wanted to say something that I noticed on the slide, and I just wanted to clarify one thing. First of all, my name is Joanna Gonzalez. I'm the ROSC coordinator for IDHS Super.
Sure.
And I noticed in the slideshow, and there is like a slide, there's always this confusion between like, what's a recovery community organization? What is a ROSC? Like, there's so much confusion alongside that, and I just want to explain that RCOs are like the boots on the ground. They're out there providing the services. These are the people that are out there providing transportation, providing referrals, linking you up with the services. Whenever you think of a ROSC, just know that ROSC do not provide services. So what the goal of a ROSC is, it's pretty much the way that we think about it. We have 43 coalitions across the state of Illinois. Think of them like the think tanks across the state of Illinois that are bringing stakeholders together. So I always say that to whenever I'm presenting about the ROSC or I'm giving a presentation about ROSC, I always tell people, just think of it like, they're like, what is it that a ROSC offers? We offer the table to bring people together. People with lived experience, treatment providers, your local barber, who could be involved in a ROSC, any and everyone who is passionate about helping people in recovery. And what that looks like could be whatever the person chooses. So it's not, it could be, we want your AA providers, right? Like if you're providing AA services, we want those at the ROSC. If you're providing harm reduction services, we want those at the table. We want to be able to have like an a la carte of all types of different services, just making sure that we're not excluding anyone. So I just wanted to clarify because I saw it in the slide and it said services, but I don't want anyone to leave confused because ROSC do not provide any services. What we do is we bring people together and think about how can we create systemic changes, like things that are going to outlast the life of a ROSC. Like how can we get these, like we were talking about MAR now, we're talking about medication-assisted recovery, harm reduction. How can we start promoting these things and making sure that these things stay in the community, right? And it doesn't depend only on funding. And I know I'm speaking from IDHS Super, and I know that but it shouldn't, but it really shouldn't just depend on funding. It should depend on just bringing the community together to believe in that mutual, this is what we're all rooting for. Everyone that's here in RecoverCon we're just passionate people, and I just want you to know that all of you have a place in a ROSC council. So if you're not involved, if you don't know what it is, if you're curious about it, I welcome you to reach out to me. I have my business cards. I can connect you to each and every ROSC council across the state of Illinois. I can also partner with you guys where we have our recovery quarterly meetings that IDHS Super hosts. We bring all of our recovery champions together, not necessarily people who are funded by us. We bring everyone together so you guys can network, we can collaborate together. So I just thank you for giving me a chance to talk a little bit, but thank you.
So, I'm going to add on a little bit to that. So deflection, we also have those tables where everybody's that think tank, and it's very community oriented. The goal is that a lot of times building those collaborations, so a lot of times we come into those rooms and we have treatment providers that are like, I didn't even know you existed, and I didn't know you have 10 beds open. Wait, huh? I have a wait list, can I come and help you out? So that collaboration, working together, or reducing the redundancies in services, because sometimes you have people in the community that are going to 3 different places getting the same service, and why are we all doing repeat services? So trying to reduce that redundancy of services. When it comes, it's really cool to watch teams when they actually do get to that high level of collaboration where they're talking amongst each other. How can we make sure that we communicate with each other better serve our communities, and save money in the end so we can help others as well.
You know, Joanna brings up a good point. She said a barber could be on a ROSC. A couple days ago, Josh had done 30-some days in jail and then was 30 days out of jail. He had a job interview, but his hair was a little long and flowing. I said, I sent him to Clay. Clay cut his hair, okay? On the way up here yesterday, about 24 hours ago, I get a call. She says, hey, I'm taking so-and-so to treatment, or detox. I said, okay. She said, but I don't know how to get there. I said, okay, go to this gas station. So-and-so's gonna meet you there to give you the gas to get there, you know. And incidentally, the person who was going is someone we've taken 6 to 8 times. You know, so it can be frustrating because she leaves pretty shortly after. But what if she's already left? And what happens if she calls Monday and says she's ready? Same thing, because we're gonna give the chances for people to recover.
Exactly. So, what questions do you have for either me, Jeff, Jack?
Yeah. Or Joanna.
Yeah, or Joanna, perfect, yes, we'll give her the mic too.
So I just wanted to clarify something or ask a question. I'm not going to make a statement. This is a real question. All right. I looked at the map. Do you guys work with CPD, Chicago Police Department, in the Cook County?
So, kind of. So they've been at the table. So right now in Cook County, we are setting up a youth deflection program. CPD has been at the table watching our entire process, listening to the providers at the table and listening to everybody that's been there. Due to some rules, they have to make their own program. So CPD will be having their own youth, at least youth deflection program. They do have a couple other like diversionary programs as well. So at least youth. Are you from Cook County?
Yeah, I mean, we work with the police department that's pretty open and does a lot of different things. So I was wondering, like, there might be a good place to pilot a program like that.
Can I get your card at the end of it?
Hi, I'm Laura. I'm new to peer work. I work about 15 minutes away from here. And I'm really excited. I'm just sitting here and feeling the energy. We have services, we have people with lived experience, we have hope. But I think, let's back it up. Before we tell someone where to go, or tell someone, you need help, I want to fix, there's something before that, which is just that moment of connection. That moment of, I'm going to sit with you on the worst day of your life. No matter if this is the 15th, 16th time you're going into treatment, I'm going to sit with you. And I will feel you. And I will understand you. And we don't need to fix in this moment where you are spilling your guts and your tears and all that. It's not going to swallow us up. We can do this. And like that part of the peer work, that works in my family. That works with my friendships. And it works here, you know? Other than like keep going, I don't have any specific things to add other than like I'm proud to be in the community, right? Like look at all of us. It's just really amazing. So thank you for letting me take a second.
Hey, James. Hi.
Hey guys, thank you, Koren, thank you, Jeff.